Have you ever wondered about the common problems poultry farmers face, particularly the dreaded inclusion body hepatitis, or IBH as it's commonly known? Well, today we'll delve into that very topic. Inclusion body hepatitis, a viral disease that targets broiler chickens, is caused by the fowl adenovirus group 1, specifically serotype 8. It's a particular menace for chickens between 2 to 6 weeks of age. But what exactly does this disease look like in our feathered friends? Birds infected with IBH often exhibit a range of clinical signs. They may appear depressed, show a reduced desire to feed, and display an increased thirst. In some cases, they might even exhibit signs of respiratory distress. But perhaps the most alarming sign is an increased mortality rate within the affected flocks. So, how do we go about diagnosing this problematic condition? Typically, it's a multi-step process. Observing the clinical signs we've just discussed is usually the first step. Following this, a post-mortem examination can provide further clues. And finally, laboratory tests, including microscopic examination of liver lesions, can confirm the presence of the virus. But here's where it gets really tricky. IBH doesn't just affect the health of the birds. It can have a profound impact on the farm as a whole. An outbreak can lead to a significant increase in mortality rates, which in turn can lead to substantial financial losses. So, what can be done to tackle this problem? There are several measures that can be taken. In some countries, vaccines against IBH have been developed. A consultation with a poultry veterinarian can determine if such a vaccine is available and suitable for your region. Strict biosecurity measures can also help prevent the introduction and spread of the virus. And if a bird is found to be infected, it should be isolated immediately to prevent the virus from spreading within the flock. In conclusion, inclusion body hepatitis is a significant threat to poultry farming. However, understanding the clinical signs, knowing how to diagnose it, and implementing preventative measures can help keep this threat at bay. And remember, there's a product called kenotoxplus, which can be administered at a rate of 300 to 400 milliliters per 1,000 birds for 5 to 7 days. So, while the challenge of IBH is real, with knowledge, vigilance, and appropriate measures, it can be managed effectively. And that's good news for everyone in the poultry industry.